Okay, we have Dr. Jessie Graychek here. Of course, I love that she shares a name with me. The spelling of her last name, though, throws me. It took a long time to figure out how to spell it, but it's Graychek. I would love for you to introduce yourself, Dr. Graychek. Just give us a brief background of kind of who you are, where you work, what you do for women.
Absolutely. So yes, as she said, my name is Dr. Jessie Graychek. I grew up in North Dakota, small town. So spent the first 18 years of my life there. And then medical school was, undergrad was UND, so up in Grand Dakota. And then my husband and I went to Des Moines University for medical school. And that's where I started to really grow and embrace with my osteopathy degree. So I'm a DO. And what that is we get to learn more body mechanical type sorts of techniques. We have a mind, body, spirit is kind of how we have two extra classes to learn more about that with the body. And then for residency, we went to Illinois. So it's just south of Chicago, and did my OBGYN residency there. And we always had a dream of living in Minnesota. Love the lakes, love the parks. So moved to Minnesota. We've been here now 10 years. So I have 3 children. Just graduated from 9th grade, 6th grade, and preschooler. So she'll be in kindergarten next year. So, and we have 3 animals. Got 2 more here with the quarantine. So it's been lovely. 2 dogs and a cat. And then, so I work currently, once we moved to Minnesota, I joined the practice called Obstetrics, Gynecology, and Infertility. So I've been with them for 10 years. There are 10 of us physicians who practice there and take call and cover. So all of us do the same thing in terms of OB and GYN, in terms of any female care from 12 to till you die. And then we do a lot of infertility as well, and do surgeries and help women with whatever their needs are, the whole gamut.
Well, and I will say this, your clinic is really incredible. I say that both as a doctor on the patient side because of the feedback that I get, and then just personally I've been in your space. And you also work where I had my babies, so it's really fun. Okay, we're going to get right into the nitty gritty because Dr. Graychek has a lot of really amazing insight into care for women. And today we're going to specifically talk low back pain. I want to just hear what it is that you see in the different chunks, the first, second, and third trimester. And it can be very simplistic. I just kind of want a general recap of what it is you see in those phases.
I would say first trimester is usually, in terms of low back pain specific, it's if the patients have had a chronic history. I feel like that's when the low back pain can be for the first trimester, but otherwise in general, I feel like back pain is not much of an issue because it's more of the nausea, the not feeling well, the fatigue, those types of things. Some reflux, I would say, are the most common complaints in that first trimester. Second trimester, as the abdominal wall starts expanding and our chest cavity starts growing, that's when we start getting some of those, a little bit more of that back pain and discomfort. And sometimes it's, up, it can be either or, lower or upper. And it definitely expands even more than I would say the majority of the patients, it's third trimester. And that solely is due to the expanded growth. I mean, at halfway done with your pregnancy, baby's still under a pound. So baby goes from under a pound to average is 7.5 pounds in 20 weeks. So that's when the back pain definitely kind of ramps up.
What do you see as far as specific symptoms? Because, as a doc, like low back pain it's a pretty big global, symptom.
I would say specifically sciatica too, the back pain, it's more of the SI joint for sure. So it's that really low part, but off to the side of the middle of your spine, because that sacrum, we produce a hormone called relaxin when we're pregnant. So that is working to allow that babe to come down and through that birth canal. So those SI joints just get off, and then the pubic bone, actually that kind of wraps around then to the pubic bone is always off. And when people are trying to roll in bed or, you know, get up from being on the floor with the whole entire pelvis being just so much more fluid, those are the specific points. So right in the front, low mid pubic bone, off to the side, back SI joint. And then in terms of upper stuff, I've had a few patients, especially recently, it's like lower rib cage, you know, just in the chest wall. Because the whole abdominal wall and back is all attached to that chest wall. So when that chest wall has to expand because baby's coming up and in, they get a lot of like costochondritis, which is just irritation of the ribs, or the ribs just are out. So those are the specific symptoms.
Well, and I love what you just said, because those are the head topics that we've already gone through in the course. So I didn't even like coach you in that. That was amazing.
No.
And you actually brought up the relaxin, because I was going to ask, I guess I'd like a few more specifics in regard to the hormones, because I think there is some confusion as to the role that relaxin actually plays when it starts really kicking into the system, and then any other hormones that you see creating an issue. Maybe you do, maybe you don't, but I guess I'd love for you to just tap on that.
Well, pregnancy is more of a progesterone state. So that kicks in, I feel like really people feel that in that first trimester. And that's part of the reason for the nausea, as well as then the reflux and the constipation. That kind of all goes together. So that progesterone, and that's also why we treat people with progesterone in pregnancy if they have lower progesterone levels and recurrent miscarriages and those kinds of things. So progesterone is key. But I feel like that kind of falls off, or we get used to it, or I don't know exactly the specifics, but it's not like it's not that big of an issue as pregnancy goes. But more so than the relaxin, it's the third trimester, because that's when the body is preparing for labor and delivery to allow us to have that vaginal birth. So that's when things really start getting more uncomfortable. And you have less core, you have less abdominal wall, you have less everything to help hold everything in and be supported. So yeah.
Thank you. And now we're just going to get into labor and delivery and how it relates to low back pain, because you have a lot to manage when you're going through all of that as a doctor. So I would love to just, because you have a really unique perspective on everything that you do at your clinic. And so I'd love for you to just talk a little bit more about that.
Yeah. So a lot of it in labor, you know, just to give you a little bit of a background, we were noticing, you know, increased rates of C-sections coming about, and it's just people coming in and babies were head down, but we just were not allowed to finish that labor and delivery. So I did a little bit more digging, and I went and took a course with a midwife. It's called Spinning Babies. She developed this course. And it was lovely because you just really learn different techniques, position changes, just myofascial, like pressure points you can do, sacral movements you can do, and relaxing, calming places for people to, like, how to walk and how to stand and how to brace themselves during those earlier stages of labor. But not only that, it also starts at least when the patients are 20 weeks old. That's when I talk to patients about this woman's website, because you can start doing some of these techniques actually at 20 weeks to prepare your body, so that way then when we get to labor and delivery, we're not starting from behind. You know, baby can be in a better position, because it's quite phenomenal if you really have to think about how that all those techniques and the maneuvers that baby actually has to do to come down and through the birth canal. So yeah, those are the things that we, with labor and delivery and back pain, because the traditional position, you know, on your back, legs up, especially, you know, ending part of labor and delivery, but that doesn't have to be that way. A lot of times now people are really having that low back pain. We also think of then, especially in labor, that baby is actually facing sunny side up and putting pressure right on that the back of the sacrum. So we do some maneuvers to put mom into positions to try to get that babe to spin so that babe's looking down. And it makes the head smaller, which makes labor faster and pushing faster too. So that's what I think of specifically with back pain and back labor. for labor and
We're gonna have
delivery.
all of that linked into everything that we're talking about because
Okay.
it's such a big component
Yes.
to deal with on this end. But I love hearing you talk about that. I have to end this. I could talk to you
Okay.
all day long. Thank you so much. You are incredible. Keep doing
Absolutely.
everything you're doing for all of the women out there.
Thank you so much. Take care.
Bye.